All right, everyone, let's dive into the fascinating world of newborn assessment. Think of this as learning the checklist for a tiny brand new machine, a newborn baby. Each part needs to be carefully inspected to ensure it's functioning properly. Now, let's start with the basics, shall we? B. Vital signs. A newborn's heart is like a little race car, running fast to keep up with the demands of their growing body. Resting heart rate should be between 110 to 160 beats per minute, apical. If the baby is sleeping, it may slow down to 90 to 110 bpm, but if they're crying, it can speed up to 180 bpm, almost like a car revving its engine. Use a stethoscope to auscultate at the fourth intercostal space for a full minute. This ensures you catch any irregularities. Respirations. Babies breathe faster than adults. Normal respiration is 30 to 60 breaths per minute. Always assess for a full minute because their breathing can be irregular, like waves lapping at the shore. Order of vital signs. Start with the heart rate and respiratory rate before moving on to other vital signs. It's like taking a sneak peek before they wake up fully. Temperature. Normal axillary temperature is 97.7 degrees Fahrenheit, 36.5 degrees to less than 99.5 degrees Fahrenheit, 37.5 Fry. Imagine the baby as a loaf of bread. The temperature needs to be just right for perfect baking. Blood pressure. Typically, blood pressure isn't checked in healthy newborns, but if a cardiac issue is suspected, it's usually around 80 to 90, 40 to 50 millimeters Herbs. C. Body measurements. Length, between 18 to 22 inches, 45 to 55 centimeters. Think of this as the blueprint size of the baby. Weight, 2,500 to 4,000 grams, 5.5 to 8.75 pounds. Babies grow quickly, almost like a balloon filling with air. Head circumference, 33 to 35 centimeters, 13.2 to 14 inches. The head is like the control center of a spaceship, crucial for the mission. D. Head, proportion. The head is about 1/4 of the body length. Think of it like a lollipop. The head is big compared to the stick, body. Skull bones, not fused. The sutures allow the baby's skull to compress during birth. It's like puzzle pieces that fit together. Fontanelles. These soft spots are like skylights in the skull. The anterior fontanelle is diamond-shaped and closes between 12 to 18 months. The posterior fontanelle is smaller and closes earlier, between birth and 2 to 3 months. Molding, temporary shaping of the head during birth. This usually resolves within 72 hours. Birth traput succedaneum, soft tissue swelling that crosses suture lines like a squishy pillow. Cephalhematoma, blood between the bone and periosteum that doesn't cross suture lines. It's more like a firm lump. Enomer. E. Eyes. Newborns have slate gray or dark blue eyes for light skin or brown gray eyes for dark skin. Their eye color often changes as they grow, like paint drying to reveal its true shade. Pupils should be equal, round, and reactive to light. A blink reflex should be present, indicating their protective mechanism is intact. Crossing of the eyes is normal because their eye muscles are still learning to work together. F. Ears. Ears should be symmetrical, with firm cartilage that springs back when folded. The top of the pinna should align with or be above the outer canthus of the eye. Low-set ears may indicate conditions like Down syndrome. G. Nose. Babies are obligate nose breathers. They primarily breathe through their noses. Occasional sneezing helps clear obstructions like tiny windshield wipers. H. Mouth. Gums should be pink and moist. Look for Epstein's pearls, small white cysts that resemble pearls. The root reflex, turning toward touch, and gag reflex indicate a healthy nervous system. I. Neck. The neck is short and thick, holding the head in midline. Assess for torticollis, where the head tilts to one side due to muscle issues. It's like a tree leaning in one direction. J. Chest. The chest appears circular with equal anteroposterior and lateral diameters. Diaphragmatic respirations are normal. Both the chest and abdomen rise together, like synchronized swimmers. K. Skin. Skin can range from pinkish red to pinkish yellow, depending on skin tone. Check for vernix caseosa, the creamy protective layer that's like nature's moisturizer. Look for birthmarks and Mongolian spots, which are common in darker-skinned babies. Assess for acrocyanosis, bluish hands and feet, which is normal in the first few hours. Check skin turgor over the abdomen to assess hydration, like testing the elasticity of a balloon. L. Abdomen. The umbilical cord should have 3 vessels, 2 arteries, and 1 vein. Fewer vessels might indicate other concerns. The cord stump should be clean and clamped for at least 24 hours. Like a plant cutting, it dries and falls off naturally within a couple of weeks.